Hello, welcome to the James Cooley Show. It's your life. I'm your host, Dr. James J.C. Cooley. And wow, we got an absolutely magnificent show coming your way today. Right now, we're having a little technical difficult, but we're gonna be okay. We're gonna be okay with it, and we're gonna get Doc on real soon. I see that he popped up here, and Michelle's gonna be working with him. But Dr. Michael Mantell, how you doing today?
Doing great, and you guys look like you're having a great time.
Oh,
And
we in the Dominican Republic, and all is well. I see Dr. Wayne just popped up, so I think
great.
we good, yeah. But we in the Dominican Republic having a great time, Doc. I mean, you know what I'm telling you.
Oh yeah,
It's
Punta Cana is beautiful.
Punta Cana is absolutely fantastic. We got a top-notch show coming your way, Doc, and I can't wait to meet Dr. Wayne and hear all about him and all this other stuff. But I tell you what, before we do anything, we got to bring the radio, television, podcast, all 68 platforms locked in at the same time. Todd, can you hear me? Todd, can you hear me?
I got you loud and clear. You sound great. I love the energy. You and Dr. Mantell have so much energy. I love it. We're locking in the radio station right now.
Get ready to lock into the radio station.
It's Your Life is sponsored by James J.C. Cooley.
Dr. James J.C. Cooley. The James Cooley Show. It's your life.
Hello. Welcome to the James Cooley Show. It's your life, and I tell you, I am so excited. Michelle and I, we're in the Dominican Republic. We're having a great time. It's just out there, and you know what they said: black people can get tans. I guess what Michelle and I
Still need sunscreen.
yeah, we just been having so much fun, and hey Doc, we had it's 10 of us coming from Chattanooga, Tennessee. We've been together. I've been knowing each other, friends for 50 plus years, and we're still living and we still like each other. We still travel together. So that's where we at today. And Doc, I am so excited about this show that we got, and I'm excited about the guest that we got on today, and I can't wait. But Doc, just want to tell you, Michelle is having problems pulling up
I'm here.
Oh, she's here right now.
I am here.
She's going to introduce the show. She's going to introduce this absolutely fantastic guest. And,
Okay.
I'm going to sit back in the background. And, Doc, it's all yours today. So
I got it. We're ready.
I'm doing great. The sun takes a lot out of you, but I'm enjoying myself.
Yeah. So we rushed back to make sure we was here. Hey, Dr. Cooley, can you please introduce the title of the show, the purpose of the show, introduce this great, the host today. He's not the guest host, he's the host today.
Yes, he is.
And also introduce this absolutely fantastic guest.
Oh, yes. Well, the title of today's show is 360-degree Health Day. We're talking about lifestyle medicine and Blue Zones Health. And our guest host today is the amazing Dr. Michael.
No, he's the host today.
I think, okay, he's the host. And you know
I'm being
what?
promoted.
He is having a sit-down conversation with Dr. Wayne S. Dysinger. He's the Chief Medical Officer of Blue Zones Health. They're going to be discussing chronic disease, how it can be frequently reversed, new clinical lifestyle medicine-based clinical models that are needed to accomplish this. Value-based reimbursement models are needed for lifestyle medicine to truly thrive. He's going to discuss Blue Zones Health merges consumer demand with the VBC reimbursement models and the LM clinical models. Wow, that's over my head, but he's going to educate us on that. So Dr. Wayne Dysinger is Chief Medical Officer of Blue Zones Health. He brings decades of leadership in evidence-based lifestyle medicine together with the Blue Zones principles to deliver primary care through an innovative economic model for employers and government payers. He was previously chair of the preventive medicine department at Loma Linda University Medical Center, where he was inspired by the original longevity studies. From there, he decided to further pursue the study of lifestyle medicine and its ability to treat and reverse chronic disease. This eventually led to his past positions as president of the American College of Lifestyle Medicine and founding board chair of the American Board of Lifestyle Medicine. Wow, there's so much about this guest. We're just going to introduce him and let him talk about it. Ladies and gentlemen, please welcome to the show, Dr. Wayne Dysinger.
Dr. Dysinger, thank you so much. And I know that one of the keys of lifestyle medicine is being outdoors, physically active in nature. So we're going to let these two people go back to their vacation in the beautiful Dominican Republic.
Just want to ask one question before you go, Doc. Dr. Wayne, if I saw you, I want to salute you.
Thank you.
Fantastic, superb bio, everything. Only question I have is, can you please tell our listeners and viewers a little bit more about you, where you grew up, what makes you so passionate about what you're doing, and why you so caring about everything for the betterment of others. And Doc, Mike, it's back to you on that one.
Take care. Have fun out there.
Thank you so much. Yeah.
Sunscreen.
Go live the blue zones, right?
So we were going to learn a little bit more about your background and how you got into preventive medicine. I know you were the chair of preventive medicine at Loma Linda, and then you moved into blue zones where Loma Linda is located. So let's learn a little bit about how you moved in your own life to this position from a traditional medical school background.
Yeah, so I'm from Southern California. I was actually born in Loma Linda, California. So I was born in one of the blue zones.
Right.
I did medical school there. I decided I wanted to be a primary care doctor, so I got trained to do that. Then I did additional training in preventive medicine, practiced in a variety of different places, got into academic medicine, so worked at Dartmouth University in New Hampshire, and then Loma Linda recruited me back to be the chair of preventive medicine. And as I came back to Loma Linda, there was this thing starting called the American College of Lifestyle Medicine. It was started by one of the faculty in my department and in the preventive medicine department. And as I started digging into that more, it just started growing on me. And lifestyle medicine is basically this concept that 80% of what we deal with as far as healthcare issues are what are defined as chronic disease. And when you look at chronic disease, 80% of that is directly related to lifestyle choices. So we know that if you eat better, you exercise more, you stress less, you sleep longer, those kinds of things actually help to prevent and even reverse chronic disease. So I was watching that in my own patients. I was watching that in medical students I was teaching at their energy and excitement for it. And I was watching the science around that just growing and growing. And so I just started pushing more into it. Eventually, so much so that I left Loma Linda 10 years ago because I knew that we needed clinical models and we needed economic models. Because if something innovative like that is ever going to really take off, it needs those models. So I spent a long time, a lot of hard work, a lot of persistence, sort of toiling in the trenches, trying to develop some of those examples, those examples of clinical and economic approaches at work. We had some success. A couple of years ago, we had some investors that started wanting to work with us, and that's evolved into Blue Zones Health. Blue Zones Health was literally just announced yesterday, so you guys are fresh on the cusp of hearing something that just was formally announced. And what Blue Zones Health is a partnership with these kind of principles that I've been talking about, the nourish, move, connect, renew kinds of things. It's a partnership of the clinical and economic models that we've developed with the Blue Zones Institute, which is this organization that knows how to help communities become healthier based on these 5 areas of the world where people were living longer, better. So we learned from them. We're adding that into the science that we already knew, and we're just pushing forward, trying to transform health.
Well, congratulations. I cannot tell you how genuinely, I mean, it sounds like a lot of smoke, but how genuinely honored I am that you've taken time from this remarkably busy schedule to spend time educating our audience about preventive lifestyle health, and specifically to congratulate you on this launch, this official launch, which I just read about yesterday. Talk about coincidence, as if there is anything like a coincidence between Healthfully and Blue Zones to have this Blue Zones Health. So I'll tell you about another coincidence later, but let's start with because people have heard about Blue Zones. They may have known the story about how the Blue Zones got to be labeled with the blue marking pen and all that. And I know my wife and I and family spent some time in Costa Rica, and it changed our lives. It's one of the Blue Zones. It was absolutely life altering. The way we eat, the way we move, the way we live, the way we gather, just all of it. And we saw firsthand families living in the most healthy ways we could ever imagine. So tell us a little bit about the pillars of Blue Zone living.
Yeah, no, that's the right question. So Blue Zones has what they call the Power 9. These are 9 practices that people in the Blue Zones tend to have in their lives.
Wait, I'm going to interrupt for one moment, and please forgive me. I'm doing this a little bit winging it on my own today. Usually have Dr. Cooley helping out, but we have about 1 minute before the break. So we're going to start the answer, but then we'll take the break and come back.
Sure. So the Power 9 are divided into 4 categories, and those categories are the ones I sort of already referenced. The first one that we talk about is nourish. So it's some things around food. The second one is what is called move. So it's just things around physical activity. The third is what we call renew, but it's things around stress and sleep. And the fourth is called connect. And we're
going to go into these. These are very important. And if people have questions, and I hope they do, they can call in at 1-888-344-1170. You can write your questions into us on all the platforms. We're here to take your questions, and we have lots of answers. So let's go to our break, and we'll come back right after that with some great answers from this illustrious Blue Zone leader, Dr. Wayne Dysinger.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
A black
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold.
enlighten our next generation of leaders and heroes, get your copy of Country Boy, City Boy, A Journey That Ain't Over Yet by James J.C. Cooley, available on Amazon and everywhere books are sold.
And
Yeah. Dr. James J.C. Cooley.
I think we're back. I think I appreciate that. Go rolling with the flow here, Dr. Dysinger. So if anyone has any questions that you want to speak to us directly, please call in to KCBQ at 1-888-344-1170. Or on any of the 68 different streams that we have, you can go on in and write a question to us, and we'll be sure to answer them. I just asked you, Dr. Dysinger, about the pillars of what blue zone living is. And you said, if I took notes correctly, nutrition and movement and balancing stress and sleep, resilience, connectedness, fostering a community, exactly what we saw when we visited Costa Rica. So let's go into those and talk a little bit about how this lovely sounding description of a healthy life really does impact health and how that's changing medical care. Notice I didn't say treatment, I said care.
Yeah, and I think, you know, within those four, we call them the core four. There are these 9 principles. So just briefly, what those are. Under Nourish, there's 2. One is called Plant Slant. The other is called 80% rule. So it's the idea that you don't fill yourself up every time you eat. You sort of eat to 80%, and then you pause your eating at that point. Plant Slant's obviously about trying to have more of your calories come from plants, less from animal products. There's sort of a third one in there. We call it Food at 5. So, but it's partly Connect. So it's partly the social aspect of eating, but also partly sort of let's eat from sort of a mindfulness perspective. Let's enjoy our food, eat slowly, those kinds of things. So that's under the Nourish category. Under the Move category, there's one. It's called Move Naturally. So when these blue zones are studied, the idea of having actual exercise routines, going to the gym, that's less there. The idea of just choosing to walk to the grocery store instead of drive if you can, and those kind of things, move naturally. Obviously, in our culture, we're not opposed to gyms and the idea of strength training, the idea of stretching, the idea of cardiovascular training. Those are important. But under the Power 9, it's just the move naturally. Under the Renew or the Resilience category, there's 2. One is called Stress Less. So that's the idea of having ways to deal with stress. Stress is going to be there, but we don't want to get stuck in the stress. We want to be able to flow with it and move on from it. So having a toolbox that helps you do that. And then we like to throw in the sleep there as well. But amongst the Power 9, the other Power 9 category is called Purpose. So having a goal, a vision. So we talk in our practice, we talk about a vertical connectedness. We need that vertical connectedness, that purpose, that spirituality, that reason for being. In the Okinawa blue zones, they talk about ikigai. Ikigai is this, what really drives us. What in Costa Rica they talk about the reason for living. What is your reason for living? So those are the first 3 categories. The fourth one is really, as you study the blue zones, it's really the most important category. It's the Connect category. So there's several in that. Like I said, that Food at 5, some of that comes under the Connect category. Like I said, Purpose, we call that a vertical connection. So there's some Connect in there. But the other 3 that are listed there, one is something that's listed as Right Tribe. So having friends that make good choices. Part of our issue is it's easy to make poor choices in our culture right now. So having friends around you that encourage you to make good choices, that's your Right Tribe. Another was Family First. So the idea of investing in your family and then allowing them to invest in you. So stay close to them. Put work into keeping that family connection first. And the final one is called belong. And belong is really about having a spiritual community that you're involved in. And that can evolve in a lot of different ways. It can be classic church or mosque going. It can be small groups. That can be a variety of different ways. But the point is you have this group that you connect with on sort of this higher level, this religious level as well. So those are the Power 9. And it's a whole other category of how do we bring that into healthcare? But
right, that's the question. So the patient shows up with hypertension or diabetes or cardiac issues, and whatever they may be, the traditional kinds of things we think are associated with stress and poor living and so forth. And they think that they're going to get a pill, medicine, blood tests. How do you begin to present this to them as something very different?
Yeah, so I'm a regular medical doctor. I was trained, the way most medical doctors are trained. And when you're trained as a medical doctor, you actually don't spend any time looking at that Power 9. You don't spend any time sort of analyzing the core 4. We get very little training in nutrition or exercise prescriptions or any of those kinds of things. But since this American College of Lifestyle Medicine started, there's now training for physicians, for other healthcare professionals as well, in those areas. So obviously, I was actually lucky enough to help create the training, but there's a board certification in that. So you can find there's now, I think it's 6,600 or so physicians who are board certified in lifestyle medicine now. So you can actually find them. You can go to websites and find these people that are board certified. But the point behind giving that level of detail is these are physicians who think differently, right? So when I was trained in my typical medical training, my training was to try to find out what's wrong with a patient. So get them to tell me what's your problem, what's wrong with you, and then try to fix that thing that was broken. So that's a mindset. What's wrong? How do we fix this broken thing? That's a mindset. In the lifestyle medicine world, what we think about is what's your journey? So what happened? Instead of what's wrong, we ask what happened. So what's your life journey? And then once we understand the life journey, our question is, so what's out of balance? What can we do to bring people back into balance? So it's a different mindset from what's wrong and how to fix it to what happened and how do we bring into balance. And so just an example of a patient I saw this morning. He had
I was going to ask for that. That's great.
Yeah, he had chronic pain issues. He'd been to all kinds of different doctors. He'd been had all kinds of imaging studies, all kinds of different tests, and nothing was really helping. He had these chronic pain issues. So I spent some time trying to understand what is his life journey. What has happened to him as he's gone through life. I spent some time trying to understand his level of balance in those 4 core areas that we talked about. And then we did a prescription. So one prescription that I gave him was to actually start doing some yoga. I felt like some stretching would be in there. And I mean, this was my first time ever meeting him, so I still have a lot to do to get to know him. But then I'm thinking, are there foods? So for instance, if someone's having inflammation, we can prescribe dark green leafy vegetables and berries like blueberries. Those are very high in antioxidants. Oxidative stress is one of the biggest issues with inflammation. So if we can bring in a food that decreases oxidation, that's a great thing, and it helps with inflammation. And guess what? It's natural. It's not that expensive. There's like zero risk to it, and it works as well as say an ibuprofen or some of these other things. So that's the kind of thinking that we do in a lifestyle medicine practice. We try to bring in those natural principles. We try to bring in things that are scientific, that are evidence-based, but that are very low risk, very low cost, and try to help people bring back balance into their life. And frequently that'll do a great job of helping them to decrease and even reverse their diseases.
we have just about a minute left before we're going to go to our next break. And hopefully this will be a smoother opportunity to do that. But when we come back, I'm interested in the challenges that patients have in wrapping their heads around this. So wait a minute, not a pill, but leafy greens and blueberries? And this changes the whole nature of the relationship. I've long said, when I was practicing clinical psychology, saw patients, and now I see clients, that if you don't take the medicine, don't expect the medicine to help. So when I come back, I want to hear a little bit about how you help the patient understand the value and to actually do what you are asking, what they can do to adhere to your suggestions. We'll be back in just a moment. If you have questions, be sure to give us a call at, what was the number? Oh, my goodness, I forgot the number already.
1-888-344-1170.
There it is. We'll be back.
There's more stories of greatness to help you overcome adversity coming up on It's Your Life with James Cooley.
Country boy, city boy.
Dr. James JC Cooley. The James Cooley Show. It's your life.
And overseas. We hope that you'll be able to take
Dr. James J.C. Cooley from the United States of America, and I am here to just say, first of all, I'm so happy and honored to be on it, to be in the Coffee Book 2023, Unified Brain Z, and the other organizations. Thank you so much for giving me an opportunity to be a part of this collection.
The James Cooley Show. It's your life.
We are back. Another break that went smoothly. And the number is 888-344-1170 if you have any questions. And we're on 68 different streaming channels all across the world. Please, if you have a question, dial in. We'll get you on right away. Dr. Dysinger, you are an international voice on the transformational power of lifestyle medicine. We've been using the term lifestyle medicine, blue zones, preventive medicine interchangeably. I know that you've alluded to the fact that 80% of healthcare deals with chronic diseases, which can be addressed by choices. But making choices, behavioral change, is not always easy. The whole field of health coaching has opened up to that. What are some of the effective methods that you use you use in your daily practice, and all the other practitioners, the providers, the healthcare professionals use to help patients make lasting lifestyle change, as opposed to, I tried the blueberries, but it didn't work, and I'd rather take the ibuprofen or whatever it may be. So give us an example of like what, as a patient, they may experience to begin these behavioral changes.
Sure, it's a great question, and like you said, lifestyle medicine can't do anything. We can't bring people towards a Blue Zones health lifestyle unless they change behaviors. That's part of what it's about. And unfortunately, our society, our culture, tends to make the unhealthy choice the easy choice. So what we're about is trying to make the healthy choice the easy choice. So how does it work? Well, there's three behavioral health principles that I'm sure you're very familiar with. One is what we call motivational interviewing, and that's the idea that the patient's the boss, the patient's the one that makes the choice, that helps decide what is the next step that they're supposed to take. So we spend a lot of time trying to help patients make decisions on their own. We just support them. We might guide them a little bit, but they're the boss. They're the ones that make the choice. So for instance, in the patient example I gave, I had to make sure the patient liked blueberries and liked green leafy vegetables. I had to make sure that yoga was actually something that they would consider doing, that they were feeling positive towards. So motivational interviewing is one. Another is something that we call positive psychology. That's the idea of building on your strengths, the idea that you have one success, and then you feel good about that, and then you can build and have additional successes. So we spend a lot of time helping people get small wins, and then supporting them, getting excited about those small wins, and then helping them build on additional wins. And then the third area that we talk about is cognitive behavioral therapy. And that's a whole huge, massive field that's been around for decades. But how we apply that in a particular patient interaction is we try to find the small win that's available to them. So cognitive behavioral therapy is sort of like about reframing a bit. And we try to reframe so that, say you're trying to lose 50 pounds. Well, if you're trying to lose 50 pounds, that's a big thing and it feels overwhelming. But if you can recognize that maybe taking the cream out of the coffee is something that you can do, or one of my favorite prescriptions, cutting back on cheese, maybe that's something you're willing to do and can do. And so that will be the reframing. And if you do that, over time, the calories add up. And you're all of a sudden moving towards your goal of losing 50 pounds.
I've got to ask you something. You said earlier, and Ballanduro, psychiatrist, a very dear friend of mine, of the shows, she just wrote in. She said, yes, we should be asking people what happened to you, and what happened to you, and what happened to you in your life. I want to reframe that. I help my clients not ask what happened to me, but rather what happened for me in my life. How can I think about what's happening in my life in a different way? And as you know, motivational interviewing, if I lose the 50 pounds, what can I look forward to? And if I don't lose the 50 pounds, what can I look forward to? So one of the things you're saying, and patients hear this, doctors don't always tell. Doctors ask. And that's what Dr. Dysinger is helping us understand, that by asking and helping us think about things, what you're saying, Dr. Dysinger, is you, the patient, are in charge. No one's going to lift a weight or eat blueberries unless they first tell themselves, this is good for me and I can do it. So the whole practice of medicine changes. Okay, let me shift gears real quick. Today, I read an article that someone sent it to me, another guest who's coming up. Mike Waters is going to be coming up in a couple of weeks. He sent this article about the fittest cities in America. And I thought my city, San Diego, California, was going to be number one. It wasn't even close. Arlington, Virginia, I'm going to just read, and you're not going to be surprised, I don't think. The city's built environment, parks, bike paths, walking trails. 76% of the residents said that they got at least 7 hours of sleep every night. Only about 3% of the residents smoke, which was the nation's lowest report. Let's talk a little bit about the role that community plays in preventive health and lifestyle health. So can you talk a little bit about that? I know you're in Southern California and you're going nationwide, but what about communities that don't have these beautiful areas to walk and bike in and so forth? What can people do in those communities?
Yeah, it's another great question, and just sort of going back, Dan Buettner started studying these blue zones 20 some years ago and recognizing them as a community. So the community question is central. And when we went through those Power 9, at least 3, and you could make the case for 5 of the Power 9 are actually sort of a connection, a relationship, a community-driven kind of practice. So as Dan Buettner sort of identified these things that were helping people to live better, longer, he said, well, let's go do some community transformation. So he started doing that. He's originally from Minnesota. The first community he worked in was called Albert Lee, Minnesota, and just a small village. And he got some amazing statistics in just a few years of time of changing that community, changing the kinds of health parameters that you mentioned Arlington, Virginia has. And then he said, there's an opportunity here to help more communities. So now there's about 85 communities across the United States who have signed up with Blue Zones to say, help us. We want to change our built environment. We want more walking groups in our community. We want more restaurants serving healthy food options in our communities. We want more even bridge clubs or bowling groups or whatever, people bringing people together, creating this connection. And we want to talk about this as a community dialogue about it. So Blue Zones goes into communities and helps that to happen, and has some great statistics from some larger communities too, like Fort Worth, Texas. So there's that experience. What Blue Zones Health is doing is they're coming in and saying, actually, the health component matters. So if you are trying to do a walking group and your doctor actually is overweight and doesn't do any exercise themselves, then that's going to make it, it's going to not help you be motivated towards that. So Blue Zones Health is bringing in the clinical, the medical part to these Blue Zones communities.
Organizations to create healthier environments.
So I'm sorry, there's a little cut, so I'm not quite sure.
I said, are you working with the local governments and organizations to help create these healthier environments?
Absolutely. So in a Blue Zones community, the government is involved, whether it's the city government or the county government. In some cases, it's been the state government even. There's local industry involved, so businesses that are passionate about health. Usually the healthcare industry, the local hospitals involved in these types of things. Local philanthropic organizations that are good at reaching out to communities. So it's a whole community network that works. And then what we're bringing in is the doctors, the primary care doctors and those types of things.
We're going to get into more of this. We have a break to take right now. If you have questions, please call us at 888-344-1170, and we'll be sure to answer your questions. And I see someone made a comment or just spun by. We'll come back to that. But lots of opportunities for living a healthier life. It's your choice. Come back and learn some more.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave, high school, you gotta know today or tomorrow, or hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create, collaborate, commit with confidence. Commit with what? Commit with what? In everything that you do.
Dr. James J.C. Cooley. The James Cooley Show. It's your life. Get it? Dr. James J.C. Cooley. The James Cooley Show. It's your life. The James Cooley Show. It's your life. Doctor. Let's go. It's the James Cooley Show. It's your life. Dr. James J.C. Cooley. All right. The James Cooley Show.
And we are back. Thanks very much, Dr. Wayne Dysinger, who is a remarkable leader in the field of lifestyle medicine, president of the American College of Lifestyle Medicine, founding member of the board of, what's the title of the organization, the related organization?
Yeah, it's the American Board of Lifestyle Medicine. So it's
Right.
the organization that certifies people in lifestyle medicine.
Right. And you created or helped create the training program in that. So this is, ladies and gentlemen, this is the voice in what is trending in healthcare today. By the way, Washington, D.C., right across the Potomac from Arlington, also is way up on the list of the nation's second fittest city in the country. They found, we talk about fruits and vegetables, nearly 38% of residents consume 2 or more fruits a day, the highest rate among 100 cities. Not surprising. And more than 21% of Washingtonians said they eat 3 or more servings of vegetables per day. And we go on to their exercise and all that. I want to turn a little bit to another topic. The only place that I know that the mind and the body are separate are in ancient medical textbooks. And maybe really ancient medical textbooks, they were united. But in real life, we know the mind and the body are one. Now, the index that looked at the fittest cities in America that came out today cited the role of mental health in a community's overall health. This was a stunning statistic. 45% of people nationwide say they are in poor mental health and have been that way for the last month. That's stunning. More people are suffering mentally, and nearly 38% of people surveyed said that they were also in poor physical health. Not surprising. Let's talk about what preventive medicine, lifestyle medicine, blue zone living can do for our emotional well-being.
Yeah, so what I like to think about when you ask that question is what it's like, an experience in a Blue Zones Health office. So when you walk in, there's fresh food out there. There's water that you can take advantage of. People greet you. It's like a family. It feels almost more like a health club. Doesn't feel really like a doctor's office. You go into the room, and what's there is sofas and easy chairs, and I'm sitting in one, and the patient's sitting in another, and we're talking like friends, like we're connecting that way. And what it does is it sort of takes out the fact that we're not trying to fix something that's wrong. We're just trying to get to know people, to understand them, and recreate balance in their life. When you were talking about ancient medical texts, if a couple 100 years ago, 300 years ago, if you were sick, you wouldn't go to a doctor. You would go to maybe your shaman or your druid or whoever it was in your village, in your community, who is frequently a spiritual leader as well as just a wise person. So going back to the Power 9, a lot of those, I would say the Renew and the Connect Power 9 are very related to, so how are you doing as far as your mental health? The ones that are more focused on physical are perhaps the exercise and the nutrition. So it's very much there in everything that we do. But it starts off with relationship. You can't have good mental health unless you've got a team and a connection around you. We do a lot of our work in groups, so it's not just the typical one-on-one. And we have a lot of resources. We have specific behavioral health resources like social workers and chaplains and those kind of people that can bring people to the table. We have health coaches, so within our practice, you can get assigned a health coach. So there's a lot of areas there that allude to the importance of mental health in overall health.
In the way most people think of going to a doctor and being treated. And I always have said, when doctors became providers, healthcare went downhill. Doctors who are carers and who take care of people as opposed to treat people probably get far more benefit. Now, so what do you imagine are some of the future expansion of Blue Zone's health that we can see? You're already way ahead of the curve, but what's next, if you can share that? Any ideas?
So an important thing to us is we want this to be affordable to everyone. So we spend a lot of time thinking about how can this be affordable to everyone. The kinds of things that we do are already available to people. If you can, pay a few $100s a month and be a member in some kind of fancy concierge type of practice. But in our practice, we use Medicare as our reimbursement. And we specifically use Medicare Advantage. Medicare Advantage, over 50% of Medicare in the U.S. is Medicare Advantage now. And Medicare Advantage is basically no cost to, if you're a senior or someone with a major disability, it's basically no cost to you. But we have an agreement. Long story how we got that agreement, but it's an agreement.
Oh, we're going to have you back. We have to have you back again because this can go on for a long time. We know that this is so interesting. But let's hear what you're going to say.
Well, just that Medicare is one of our best reimbursers. So for that segment of the population, we do have a goal of reaching to employers and having employers help to pay for this. We have a lot of connections, and we feel like, and I can actually say over the last 2 days, we've met with 2 of the major insurance companies in the U.S. Who are excited about the Blue Zones Health concept. So we do think that there will be opportunities if you have a commercial insurance to become a member of Blue Zones Health. Of course, we do have an option if you want to pay for it yourself. So that option is available. We're currently only in Southern California, but starting January 1, we're going to be available nationwide. And you can go to our website and start signing up for opportunities to be given announcements of what's coming in your area.
So we just have a couple more minutes left. By the way, are you in San Diego?
I personally am in the Inland Empire.
Uh-huh.
We have a clinic in Redlands, a clinic in Riverside. We're starting one of our standalone clinics in Santa Monica. So that's going to be our third clinic. But we have over 200 providers that are affiliated with us throughout, including down in San Diego. So we have some great physicians down there that are
fantastic,
practicing with the Blue Zones type of lifestyle.
This is the way to go. Which is interesting, as someone who works with Medicare for my own insurance, that's a segment of the population that's older, and they're turning to something that's going to be really positive. We want to have you back because you are just a wealth of information, and you're a nice guy. You come across in a really nice way, and I'm sure our audience has really appreciated and enjoyed listening to you. What people want to learn more, what is the website?
The website's Blue Zones Health, bluezoneshealth.org. That's our website.
bluezoneshealth.org, and you can sign up and be on a list to get all kinds of information anywhere in the United States. This is growing, and this is going to be the way you want to be taken care of. Now, this is not going to replace surgery, of course, right? You're a traditional doctor.
Right. There's.
Whoops. I think we may have lost. Dr. Dysinger. I'm not sure what happened there, but we have just there he is. Okay, you're back. We were talking about traditional.
Well, I was just saying, yes, there's still a place for what I call the allopathic reductionistic approach, which is the fix what's broken. Sometimes things broke and they need to be understood and fixed. But we think that for chronic disease, you need this, what we call the holistic lifestyle approach, the Blue Zones Health approach.
Holistic preventive medicine. This is incredible. And it all started growing up in Loma Linda, which is one of the Blue Zones in America. And we can appreciate all that you benefited and that how you are sharing that with all of us. So, Dr. Dysinger, please say yes, you'll come back.
Happy to continue the journey.
Great. Okay. Thank you all very, very much. We're going to see Dr. James Cooley and Dr. Michelle Cooley's soon. Thank you very, very much. We'll see you again soon.
Thank you so much. Great to meet you and the whole team.
The James Cooley Show. It's your life. Dr. James